It was meant to be a great leveller, infecting a prince to hospital porters. But COVID-19 is killing one group disproportionately in our community and within our health service. Sky News analysis found that 75% of all healthcare staff that have died from COVID-19 are from a Black, Asian and minority ethnic background. Stark numbers like this led NHS England to advise all trusts to risk assess their BAME staff at the end of April.
All we've lived and breathed for the past 3-4 months has been COVID. But
2 months on from that instruction, NHS staff like this consultant and many of his colleagues have still not been formally risk assessed.
To be honest with you, I'm absolutely fuming. And I suspect that a lot of my colleagues will be absolutely furious as well. This is an institutionally and structurally racist organisation. And certain groups of people are not prioritised and they're not treated the same. If this was an illness that affected preferentially Caucasians, it would be a very different story.
In fact, Sky News can reveal that many vulnerable non-white NHS staff right across the country have still not been risk assessed despite guidance from the very top. We contacted 221 NHS trusts in England to find out if they've risk assessed all of their BAME staff as recommended. 149 of those trusts came back to us, but from that group, only 23% said they had risk assessed all of their BAME staff. But one former hospital CEO says the task is too big and could lead to huge logistical issues.
I don't know a CEO of a trust who does not take this seriously and does not want to do it. But because of the numbers involved and the complexity of doing it, it's a mammoth task and it will take time.
Just this week, in a letter, NHS bosses urged trusts to complete risk assessments within a month. And today, the Chief People Officer apologised to those who haven't been assessed.
The FOI results are disappointing. So let's be clear that this is protecting our staff is the #1 priority of the NHS. It's the #1 priority of any employer because there's not only a legal requirement to provide health and safety at work, there's also the moral requirement to do that.
We are expecting a second wave of COVID-19 and questions remain whether some of the most vulnerable people tasked with protecting our lives will be fully assessed to protect theirs. Inzamam Rashid, Sky News.